So good afternoon, everybody. I'm Christine Bechtel. I'm an advisor to the National Partnership for Women and Families, which is a nonprofit consumer organization based here in DC. And I also coordinate a new campaign that I'm going to talk to you about called Get My Health Data. I do want to start, though, by saying thank you to our Champions of Change. You guys are really inspirations to those of us who've been working in this field alongside you for a long time, and we're grateful for your work. I also want to actually start by thanking the administration as well. In the last 5 years, there has been just an incredible legacy that has been laid down by this administration, in particular around the policies and the technologies that we need as patients and as families in order to mobilize clinical health information and get it out from it's being trapped in silos, all as part of a learning health system. I think what we do know, though, from many of our stories from the Champions of Change as well, is that consumers today, despite those policies and the technologies, still face reality of implementation barriers. So they still have a very fundamentally hard time getting access to their clinical health information. We think that consumers can actually be a really powerful force for change in the way that data is shared and used in healthcare if we can help them demand and use their health information. So we've just launched a national campaign that will enable that download, that demand for consumer health information so they can use it to improve their health, to improve their care, to manage their care, and including the ability to donate their data for research. We've already seen evidence that this early demand will actually cause health systems to re-examine their practices and to open up their data silos. And we think this is really laying the foundation for a healthcare system that is rooted in and views patients as, Dr. Collins said, a partners in this, and actually enables them to be innovators and really spurring new research into improving health outcomes. So our campaign has 3 goals. Number 1, give consumers the information and the tools that they need to request, download, and use their health information. Number 2, identify and promote innovative apps that consumers can safely and securely use to hold their health information, including profiling those that enable data donation for research. And number 3, and finally and ultimately, really promoting a culture that makes consumer access to data the rule rather than the exception. So the campaign is spearheaded by the National Partnership for Women and Families, but it's in collaboration with a number of really awesome organizations. Code for America is here. They've developed an automated tool that consumers can use to make the requesting of their data easier, as well as faster, we hope, right, for patients and families. You're going to hear about Flip the Clinic here in a second, who is really helping providers to deliver health data routinely to consumers. I know the Health Data Consortium is here. Nate, the Genetic Alliance, you're going to hear from as well. Anish Chopra, who is the former CTO of the United States. So these are really awesome individuals, and we're glad to have their thought leadership and support. So if this sounds like important work to you, here's my ask for you today. If you want, we ask that you start to request your health data now, that you this week take those first couple of steps, and we'll even help you through it. So you can go to getmyhealthdata.org. You can look at the resources and tools that we have for consumers. If you're a provider, you can also see the tools and resources that we have. Whitney's going to tell you about Flipping the Clinic as well. And really start to download, to demand first and then download your health information. Tell us what you find. Help us learn from you about the roadblocks that you face, and we'll even help you troubleshoot and clear those roadblocks out. So if you want to go ahead and tweet while you're at it that I am ready to @GetMyHealthData and @FlipTheClinic. We'll reach out and we'll follow up and help you dive into this world with us. Thank you.